Good evening and welcome to the UP Community Health Town Hall. This evening's episode is about National Alcohol Awareness Month. My name is Elise Burr, and this evening's program is being hosted by the Center for Rural Health at Northern Michigan University, and it's organized in partnership with Dr. Kelly Kam, epidemiologist and assistant professor in the Department of Kinesiology and Integrative Physiology at Michigan Technological University. And joining me tonight, we have a few panelists who have been very gracious about being on tonight's program. We have, Gino Bazzanesi, Community State Trooper with the Michigan State Police out of Iron Mountain. We also have Jake Mundy, Trooper with the Michigan State Police, also with Gino down in Iron Mountain. Tracy Johnson will be joining us, and she is the Dickinson Iron Communities That Care Coordinator in Iron Mountain. And we hopefully will have Naima Jones joining. She is an MSW clinical supervisor with Great Lakes Recovery Center. And also Amy Poyer, the Community Relations and Marketing Director with Great Lakes Recovery Center. So welcome everyone. Thank you for taking time to join us tonight and share this information. Naima, nice to see you. We're going to start this evening with Dr. Kelly Kam sharing some statistics with us. Kelly, if you want to take it away.
Great, thanks, Elise. So I first wanted to start off because we've had a little bit of news, I guess, on a good side of news. So this webinar and town hall series came out, for those of you that have been with us for a long time, started off as a COVID town hall that Michigan Tech had started, Dr. Steve Elmer and I had started. And we were doing these first weekly and then monthly related to COVID-19. And kind of harking back to that information, I just wanted to bring awareness to everybody that as of May 11th, the intent is that the president will end the national emergency and public health emergency declarations related to COVID-19. And I wanted to kind of just give everybody a little tiny bit of a primer of what that means. So these declarations did allow our federal and our state governments some flexibility to change requirements for certain health-related functions, including things like changes and flexibility to health insurance and authorization of certain medical countermeasures. And they included things like no cost sharing to all of us for getting COVID tests. We could get vaccines from any provider, even if they were out of our network and it was at no cost to us. And also things on a larger scale, like increasing funding to states for federal matching for Medicaid. Because of the change in the end of the national emergencies and the public health emergencies, then there are going to be some changes, in particular, to bring attention to some things like some of the coverage that was required for certain COVID-related services may be changing. So there were requirements that health insurances had to cover the cost for COVID tests. That is no longer going to be required, but your insurance may still cover this. So the important thing is to check with your insurance and find out if these services are still going to be covered. Insurances could charge for vaccinations for COVID that are out of your network. Again, they might change that. It'll be up to your individual insurance. And then really critically for anybody who is on Medicaid or the Child Health Insurance Programs or CHIP, there are going to be changes for eligibility. And so you may lose eligibility for these programs. So you really need to check with your State Department of Health and Human Services to see if it applies for you, and really pay attention to any communication you get from MDHHS or your state health services to make sure that you re-enroll and are eligible for re-enrolling, or look at the other alternatives. So we are moving into a different stage of the pandemic. It's certainly not gone. We do have, there's been recent reports of a new strain that's coming out. We will most likely continue to see this, so continue to get your vaccinations and stay healthy. With that being said, one of the things that we can stay healthy with is thinking about excessive alcohol use. So to give you guys a little bit of a background on excessive alcohol use, so in the United States, we're looking at 140,000 deaths every year that are due to excessive alcohol use just in people aged 20 to 64 years old, which is where the majority of these deaths and are occurring. So that comes down to about 380 deaths each day. These are preventable deaths. That's why we're talking about it today. And when we really look at this, because these are affecting younger populations at 20 to 64 years old, then there really is a big impact on the potential years of life lost. So for every person that's dying prematurely of an alcohol-related death, they're on average losing 26 years of life. And so when we add that all up nationwide, that comes to 3.6 million years of life that's lost early from these early preventable deaths. And then not only is there a health impact, but there's a cost to this. So nationwide, we're looking at about $249 billion in lost productivity, healthcare costs, criminal justice costs, and things like property damage with motor vehicle accidents. In Michigan, we're looking at more than 4,500 deaths each year due to alcohol, and it costs our state $8.2 billion. And those numbers for the money are on those are from 2010. So those are the most recent data that I could find, but that is pretty old data. So it's pretty costly. When we look at that, breaking that down, what that means to an individual. So for every drink that's sold in Michigan, that's $2.10 in costs related to that. So that lost productivity, healthcare costs, criminal justice. Or when we look at another way, $826 per person in Michigan is being spent on these costs related to excessive alcohol use. From a health impact, we're looking at multi-system impacts. So it's going to impact your heart, your liver, pancreas. There's multiple types of cancer that are associated with alcohol use. It can weaken your immune system, so it puts you at risk for many infectious diseases like getting COVID-19 or other infectious diseases. It's affecting your central nervous system. It can increase your risk of stroke. Especially up here in the wintertime, when we look at it, your blood vessels dilate, so there's rapid loss of body heat, which can be a problem when if you're out drinking when it's cold outside. Certainly, we know about the damage to developing fetuses in pregnant people, and if we have alcohol overdose, that can lead to coma or death from that acute toxicity. About 3.5% of cancer deaths are alcohol related, and we certainly also know that it also has impacts on our mood and our behavior. So we see things like impaired judgment and increased violence. The other thing I wanted to just kind of give you guys an idea of what we're talking about when we think about these negative health impacts. Mostly what we're looking at are the effects of binge drinking and heavy drinking. And those are defined. Binge drinking is when you're drinking, for men, 5 or more drinks in a single sitting, and for women, it's 4 or more drinks. Heavy drinking, right now in the United States, is considered 15 drinks or more per week by men and 8 or more drinks per week by women. And those differences because we do metabolize it differently. There's lots of other things that can affect our ability to be impaired by alcohol, things like other medications that you might be on, your age, your weight, your sex, also if you have other diseases that can have an impact on it too. And the last thing that I wanted to kind of bring out here is when we think about this as a standard drink. So it's often hard when we say that 15 drinks a week is a heavy drinking. Well, what does that really mean? So when we look at alcohol, it's not how you're drinking the alcohol in terms of whether it's in beer or it's in wine, it's the amount that you're drinking. So we have these standard drinks, which is considered how much alcohol there is in a drink. So if you look on the label, it will say there's a percent ABV, which is the alcohol by volume. So beer typically is considered about 5% ABV. So if you drink 12 ounces of a 5% ABV drink, then that's going to be a standard drink. Now, the problem is that beer can be anywhere from 3% up to 11% if you drink some of these specialty drinks from microbrews. And so a single beer, it depends on the alcohol content, right? So it might be 12 ounces of your Coors Light, but a specialty drink from a microbrew, it might actually be only 6 ounces. And 12 ounces is 1.5 cups. So it's not very much. For wine, the standard is about 5 ounces. So a little less than 2/3 of a cup is a serving of wine. That's this equivalent amount of alcohol. And if you're drinking hard alcohol, that's 1.5 ounces. 3 tablespoons are those little tiny bottles that you can sometimes find at airlines or at the grocery store, sometimes these really little ones. When we look at the numbers of people who are heavy drinkers or binge drinkers, it definitely matters by age. It also is going to matter by what's going on. So when it's during a a holiday season, or right now we're experiencing graduation up here in Houghton, so people might be drinking a little bit more than they typically would do. But in Michigan, about 18% of adults binge drink. In the UP, we're looking at about 16%. Definitely differs by county and differs by age as well. Among the people that do binge drink, about a quarter of those people are drinking 8 or more drinks in a single sitting. And again, among those people that do drink, about 25% or 1 in 4 of those are drinking 4 or more times a month. So they're binge drinking probably every weekend, and really drinking a significant amount. So it definitely is a problem. And so that there are certainly positive social benefits of low level drinking, but we have to think about the health impacts on ourselves and those around us, and what we're going to do to be able to minimize those risks.
Thanks, Kelly. So kind of starting us off as our panelists tonight, we have Troopers Gino Bazzanesi and Jake Mundy in Iron Mountain. And they're going to share some statistics with us and kind of talk about responsible drinking and tell us a little bit about the Angel program. So thank you for joining us tonight.
Well, thank you, Elise, and thank you, Dr. Kelly, here for getting us going. So my name is Trooper Gino Bazzanesi. I'm at the Iron Mountain State Police Post. I have 24 years of law enforcement. I mainly work days, and with me, a partner is...
Hi, Trooper Jake Mundy, and I've been with the Iron Mountain Post for 10 years, and I work afternoons.
So thank you very much. So we wanted to talk a little bit, and even hearing the statistics there from Dr. Kelly, thank you. That information is very enlightening, very much. And you know what, like when we talk about numbers and everything, I was looking at some like nationally here, and it talked about every day 32 people in the United States die in a drunk driving crash. And when you break that down, it's 1 every 45 minutes. Isn't that just unbelievable? In some of the numbers it talks about, like in 2020, there was like 11,654 people that died in alcohol impaired driving crashes. And like when you think about numbers and you look through it, and they say nationally that traffic fatality crashes are going down. They say over like a 10-year period between like 2011 and 2020, like on average, there's about like 10,500 people that'll die each year in drunk driving crashes. And one of the things that came to my mind was like, what's an acceptable number? There's gonna be a lot of people here that are going to talk tonight, and we talk because Alcohol Awareness Month and everything. But when you really think about it, like what is actually an acceptable number? And I'm sure from some they might be, well, geez, I don't know if the numbers are that high. Maybe 500. Could we get to 500? Could we get to 100? Could we get to 20? And again, when you think about it, like what if it was even just one, but that one person was a family member, or that one person was a friend? So, and I appreciate everybody being on here tonight, not only the panelists, but everyone that's listening in, is like, what can we do? And really think about it, especially like I'm from the UP, born and raised. And I think one of the things that we find is a lot of activities that we do and a lot of celebrations, as even Dr. Kelly had kind of mentioned with like the graduation of, up at Tech, and the graduation of a lot of the, colleges and or high schools coming up. A lot of the things that we do, the celebration is like with alcohol, whether it be graduation, whether it be birthdays and everything. But so like, what can we do? Are there things that we are doing? Yes. Like even as a police agency, not only our own, but our partners with the sheriff's departments or the cities and all that, we do traffic safety initiatives where we get out there and we look for, individuals that are drinking and driving and things like that. We also like go into the schools and, we do presentation, for the youth and teaching them, ways to, avoid alcohol, or if they find themselves where they're driving around with friends, and next thing you know, they end up at a camp where maybe they're not even drinking, but they're with people that are drinking, and like what can be done and things like that. So I find it very interesting that, I started this career how many years ago, and we still talk about this, and I know nationally like numbers are down and everything, but it's very important. And again, as I mentioned, like I work days. I was going to have Trooper Mundy just briefly a little bit about some of the things that he's seeing, because he works midnights, and just what are some of the things that he's seeing like on the road.
So what we're seeing, I don't have the numbers in front of me, but I know at least, especially me in my last, I'd say probably 8 months, an increase in not only OWI investigations, but operating under influence of drugs. So obviously with marijuana being legal, we're seeing a lot more impaired driving with marijuana. And then we're also seeing under the influence of prescription medication. It's becoming more and more frequent to see the marijuana and the prescription medication. And one of the things we're doing at the post level and law enforcement in general is we're trying to train our officers in more advanced techniques to compensate for, I guess, for these investigations. One of the things we're teaching right now is ARIDE, advanced. It's advanced training to recognize indicators of impairment with these medications and marijuana. So those are some of the things we're seeing. We're also seeing with the marijuana, we're seeing MIPs with juveniles, young kids, not only alcohol now, but marijuana, and under the influence of both. So we're seeing that quite often. Like I said, the last 8 months, I've seen significantly more in my personal investigations.
Thank you, Trooper Mundy. And again, we talked about like some of the initiatives and things that can be done and all that. Is we also do, of course, like the public safety announcements where we're getting out the dangers, especially when it gets around like certain holidays. We like to get the information out. And one of the programs that we have, and it's actually statewide, and thank you, Elise, for bringing it up, is the Angel program. And, maybe some people are familiar with this, and maybe some people are not, but I'm going to talk just a little bit about it. Is the Angel program allows for individuals struggling with substance abuse disorders to walk into any Michigan State Police post during regular business hours to ask for assistance. I know in the beginning, a lot of people thought it was just people that were struggling with drugs, and it's drugs, or alcohol. And so I'm glad we get to clarify that a little bit here tonight. But during them, the participant that is guided through a professional substance abuse assessment, an intake process to assure proper placement into a treatment facility. Then the Angel, where it comes in, is one of our volunteers from the local community, will then respond to the post to support the individual during the intake process and to provide transportation to the appropriate treatment facility, or even in some cases, family members that have come with the individual, they've been able to bring the individual to the treatment facility. So it's kind of in either way, but it's been great, to have at least something where we can help individuals that are struggling to come to the post and be able to help them out. Some of the things I wanted to talk about for individuals that are listening is about like, what are some things we can do? Okay. Dr. Kelly talked about like some statistics there, and we talked about a few things with statistics, but so like, what can we do? And one of the things here, and there's a few here, is plan your safe ride home before you start celebrating. That's probably one of the biggest things. Is a lot of times people, once they get in and now it's 1 o'clock in the morning, 2 o'clock in the morning, and now their judgment's going to be impaired, and now they're trying to make decisions, as opposed to start before you're going to celebrate, to choose someone as a designated driver. If you know someone that has been drinking, don't let them get behind the wheel. Take the keys, do what you have to do, or arrange someone that's sober to get them home or wherever they're trying to go. If you do drink for any reason, make sure you don't drive. Again, have the taxi. Like I know in our area here, we have a lot of taxis going around, or, if you have Uber or whatever it is, just get something where you can get home. if you're hosting a party where there's going to be alcohol served, make sure that all the guests leave with a sober driver or somebody there is taking the individuals home. There's nothing wrong with celebrating. It's just do it responsibly. And like even in the car, when we talk about like the car crashes and things like that, is, you know, just one of the things is the way the cars are designed now. It's the whole system. I know there's airbags in there, there's seatbelts in there, but they all work together. To, you know, if you unfortunately do get in a traffic crash there, to help you survive. So, and one of the other things, if you see something, if you're driving along and you see a vehicle that's all over the road, make sure you call 911 and let somebody know so we can get there and get that person off the road to be safe. So thanks again for having us on tonight, and we'll be here if there's something further.
Thank you, Gino. Thank you, Jake. For listeners just joining us, this is the UP Community Health Town Hall series. Tonight's program is about National Alcohol Awareness, and we're joined by several experts in the Upper Peninsula area to talk about this. Those of you joining us on Zoom, you're welcome to put any questions in the Q&A. If you're listening to us on any of the radio stations, you're welcome to email ruralhealth@nmu.edu. Our next guest is Tracy Johnson, and she's going to be talking to us a little bit about communities that care and what role the CTCs are playing right now in our communities throughout the UP. Thank you for coming tonight, Tracy.
Thanks for having me. It's always good to get this information out because I think a lot of us forget how important prevention really is. And we are actually dealing with prevention issues every day, all day. You know, you go to a doctor and your doctor says, your blood pressure's a little high. What might be some of the questions that, you know, you ask the doctor or the doctor says to you? He says, well, maybe a healthier diet, maybe don't smoke, you know, don't drink, more exercise. Those are all prevention measures of lowering the risk of heart disease. Another example of prevention is we all do preventive maintenance on our vehicles to last longer. We change the oil, we rotate the vehicles. So if we're all doing these things within our lives, shouldn't we be doing a little bit more prevention in other things? Like we're saying, why are we seeing such higher levels of alcohol use or marijuana use? Vaping is out of control right now. Pieces and parts of the CTC are the youth survey that we perform within all of our school districts. We get a very detailed data report back. And because I love numbers, I just don't like adding them. I just wanted to share with you a few things, and they kind of fit with all the things that Dr. Kelly was talking about when we first started tonight. So I'm not going to tell you what county this data is from because it doesn't matter, but this is 6th grade students somewhere in the UP, which our coalitions are in 14 of the 15 counties throughout the Upper Peninsula. So in our 6th grade, ever used, that means they might have sipped wine, they might have drank a beer. So ever used, already at 6th grade levels, we have 16% of our kids that have already tried alcohol in some way. But then when we look at a 30-day usage, which comes down to binge drinking or using regularly, in 6th grade, we are already at a 10% rating for 6th graders. So, you know, that's a big thing when you're looking at the age of 6 years old. And then, you know, you start talking about maybe some substance use disorders. And we all know that the science behind that is the earlier that we start using that substance, the greater the likelihood of having an issue later on in life. So when we look at 8th grade, we already have 28% of our 8th graders saying yes, that they've tried alcohol in some form or some way. And then 16% of them are using that regularly within a 30-day usage span. And then, of course, when we go into our 10th grade, because we're in the UP and that seems to be the normal here, you know, we have kids introduced to alcohol at such a really young age. we have 55% of our 10th graders saying that, yes, they've tried alcohol in some way, but we have 38% of them saying that they're using it regularly. So when students are using alcohol, we'll say at 35%, 38%, and they have a driver's license, what are the risks there? You know, we might have a not so good driver that now may have had some drinks and is also out on the roads. And then when we look at our 12th grade, we have 72% of them that, you know, say that they've had and tried alcohol, but we're at 55% of them that are saying that they're using it regularly within a 30-day usage. So with the coalition and the prevention piece, we offer Bob Finn's life skills within all of our school districts. And we start that at 6th grade, and there's about 18 sessions. The sessions are about 40 minutes long. Then we go in and follow it up with 7th grade, you know, the next year, 8th grade, 9th grade. And we also offer a Prime for Life. Well, Prime for Life is a program that makes some change in some people's thoughts and processes. So like heart disease, addiction is a lifestyle. It's a related health problem impacted by biology and the choices we make. So the Prime for Life kind of shows us what are the things in our life that we can control and what are the things that we can't. And, you know, we work through different sessions on stuff like that. And then we define the risks. So show what's high risk and what's low risk for most people. And then the Prime program defines these guidelines and explores how to adjust and apply these tools to staying at a low risk. We have, like I was saying before, the coalitions, they're all unique and they're fit to each community. So what might be happening in Dickinson and Iron County, and their risks are probably not the same risks that are going to be happening and being worked on in Marquette because the size differential in different areas. But what the coalition piece does is it brings people from all aspects of the community together to work on problems, to find gaps in services in areas that, you know, we might be lacking. And then also connecting some dots to getting some programming in, or with maybe getting those kids that are exposed to some substance use disorder to treatment. I got tons and tons of information. One of the big things that the coalitions have been working on, because the increase in suicide and depression, they've had coalition members and the coordinators trained in question, persuade, and refer, which is a 1-hour gatekeepers training to suicide, little red flags that, you know, they might be able to pick up on, and learning how to question the individual, persuade that individual to letting you help, and then referring them off to a professional. We recently have been working with Carter Kits, and that's for our community with the autistic population. So they're little kits that were made up by a family. Their young son was diagnosed with autism. He would have outbursts, and, you know, every time that this would happen, the police were called, an ambulance was called, and he was sometimes sedated. So the parents worked very hard on a way to prevent this from happening. And they found by having a weighted blanket, noise canceling headphones, sunglasses, and then some fidgets within this little tiny duffel bag, which was Carter's little kit, and it traveled everywhere with him. The minute they started using that, you know, he would have some outbursts, but everything was always able to be taken care of by something within that little bag.
Yeah.
So we are distributing those throughout each community. And right now, every coalition is looking for members to, speak up and talk about changes that they'd like to see. And you don't have to have a title. You don't have to be a professional. Anybody that, is willing to give an hour every month. There's different work groups. And like I say, each coalition has 5 for sure work groups, and some have a mental health work group. Alger County has an aged work group for their aging community. So there's all kinds of really neat things that are happening within the models of the CTC.
Tracy, is there a website that people can go to find out how they can get more information?
Absolutely. And I can put it in the chat, and I will also say it. It
Sure.
is just www.upctc.com. And that will take you to any of your community coalitions. That'll get you in direct contact with the coordinator. And, maybe just by helping out, you can save somebody's life. And I don't mean just in life, but change a situation to make, a better life.
Great. Thank you, Tracy. Joining us next is Naima Jones, and she is an MSW at Great Lakes Recovery Center. She works at the Adult Residential Services facility in Marquette, and she's going to talk for a few minutes about the 4 levels of care and service that are provided. Thanks for joining us. Oh, you're on mute, Naima.
All right, can you hear me? Okay, perfect. So I want to apologize. I'm doing this by myself, so I'm hoping that I'm not having any interruptions. So I want to apologize ahead of time. Technical difficulties being what they are. So I want to start off before getting to the levels of care of actually piggybacking on a lot of things that were already said. So I think we've all noticed things getting worse. So more people needing treatment services, more people struggling with mental health, a lot of things getting worse. And so I think that is something that as a society, my hope is that we're proactive in addressing our predisposition for escapism. So what I mean by escapism is looking outside of the self in order to feel better. Okay, so that's where we're looking to substances to make us feel better instead of concentrating on what the person actually needs. And so there's a tendency, unfortunately, in our society to figure out how to divert our attention from what's really going on. And as long as we continue to do that, it's always going to be some other issue. It's always going to be some other way that people find in order to engage in some risky behaviors. That being said, so at Great Lakes, my job really involves supporting our staff, supporting our clients, and getting their clinical needs met. And so that can start off with outpatient, which is attending some groups. You're staying at home, you're in the community, you're going to see your counselor 1 day a week, but you're living in a community, you're going to outpatient treatment 1 day a week, getting that support. And so, and then we have residential treatment, which is more intensive, where you're actually removed from the community. You're staying in our facility, which is located in Marquette, here in Marquette. And right now we have a 36-bed facility. Half of those beds are dedicated to women, half to men. And then we have 4 detox beds for those who are needing our social detox program. So those are people who have decided they want to stop. Their bodies are definitely going to feel the impact of stopping the drug or substances or whatever they're using. And so we're going to need to support them with some, frequent checks for our nursing staff, medications, whatnot. So that's what we provide. And clients are involved in programming all day. They're getting that support, that individual counseling once a week from their therapists. More often than not, there's interventions that happen several times throughout the week, but they're getting this round-the-clock service here. And so an average stay is between 30 and 40 days, depending on your insurance. But we're really looking at making sure the person's whole needs are addressed. So that's addressing relapse prevention, the thinking patterns that contribute to use, unaddressed behavioral health issues, unaddressed medical issues, unaddressed legal issues. So whatever's going on. So we're trying to address the whole person as much as possible. And so for some people, especially if they understand they cannot return back to their hometowns, they can't return back to their homes, they can look into recovery housing. And so we do have recovery housing in the Sault Ste. Marie. We have recovery housing, I think, in the Lance area. We have recovery housing here, and for men and women. And that's if a person decides that they know they cannot return to their hometowns or whatnot. We need more recovery housing because people need more help, and we need more recovery housing that can accommodate children. But we like to be able to provide that. And so what else do I want to say? Generally speaking, most of our clients are going to relapse, because human nature being what it is that anytime you're trying to change a behavior, you're going to have to go through stages. And I think one of the things that all of us can understand is that even if you are not addicted to a substance, before you make a permanent change in your life, you're going to have a lot of start and stop. You're going to go back and forth through the stages of change. And so this is not any different for our clients, that when they decide to do treatment, they're going to maybe come in motivated, and all these things that have contributed to their use are going to pop up and really cause some risk for them to relapse. And so I think what we all need to understand is that it's a process. It takes time, and there's often relapse involved because that's part of the process. The other part that's important to understand is that we do have clients, and this is what was really highlighted in some of the previous speakers, is that, and I do say this to our clients, is that we can understand the process of change. The issue is that a lot of our clientele, and this is what we're understanding, we're talking about mortality, morbidity, all these other things, is that we need to make sure that people who don't have another 5 years really work on these issues. Because what we understand is that human beings can take years to change, but some of our clients just simply don't have 5 years because of some of the things that were mentioned, because their organs have started to fail, because they're going to lose children, houses, jobs. They just simply don't have 5 years. And so our jobs are really to stop the bleeding and have the clients develop some skills while they're here so that they can take them into the community. And so part of that involves us too setting up outpatient services, setting up community mental health services, connected to whatever supports they need. Obviously, and I do want to be honest, I'm not from the UP. And so one of the things that I found that is difficult here is our transportation system. We have a lot of people who are living in small communities who don't always have vehicles, and how they get to treatment services is difficult. And so one of the things that, I'm hoping happens at some point is that we increase our transportation to the services that people need. We need to, because having services that no one can access is not beneficial. We need to have services and then make sure that people can actually access them. And that's just the case in a lot of these smaller towns. And I also see a lot of our clients who simply come from towns where there's no industry, but there's a lot of bars. There's some churches, but there's a lot of bars. And the last thing I want to say, and then at some point, maybe, I'll take questions, or I'll definitely elaborate on something if someone wants me to, is that the culture of the UP that I've noticed, and this is a Midwest thing. This is a Midwest, I will say, I'm from Wisconsin, is that there's a lot of things in alcohol. So there's camping in alcohol, there's camps in alcohol, there's ice fishing in alcohol, there's snowshoeing in alcohol, there's snowmobiling in alcohol. There's different things in alcohol, and just how we've changed even since I've been here, and how available alcohol actually is to our population. What I mean by, I don't know if you guys remember this, but there was a time where you could walk into the store and you had to walk kind of way across the store to get to the alcohol. And now you don't even really have to, in some stores, walk fully in. It's right there. It's next to the fruit. So it's just more available. And people are saying now that, you know, you go to check out at a store, there's your gum and there's your alcohol. And so we're just making it more available. We're normalizing something that really shouldn't. And I know that there was some discussion about it being introduced to very young children and the undeveloped brain and all these other things. And so I won't necessarily get into all that, but it's just important for us to not only make sure that people have access to the services they need. We're going to do our part. We're going to always do our part. But I think all of us recognize the need for services that are proactive. So thank you.
Go ahead, Kelly.
I think exactly to that point of that, when we look at the statistics that we do have, we have to think about how these are measured. So not only are we asking people to be able to estimate how much they drink, and they may not necessarily know. You've got all these newfangled drinks that are mixed vodka and fruit juice or whatever it is, and it's not a typical beer, wine, or hard liquor to be able to estimate what you have. But we also have to think about when exactly we do these measurements. So the UP Community Health Assessment is done, that survey is done in August, when it may not be, and it's asking about the previous 30 days. I'm not exactly sure when the Communities That Care question is asked, but those, if we're asking them around Deer Camp, you may get a very different answer as to what your exposure has been in the past 30 days compared to if it was done in a time where maybe there's not as many of these events where drinking is part of the culture there. And so as we think about these things, these are, you know, if it's what a sixth grader is drinking in the last 30 days, it could be a whole lot worse than what we're seeing in these numbers. And really remembering that as we look at these data, that they are a point in time, and that might not be a good representative point in time where it might be worse than if we asked right now, there might be higher numbers than before.
You know, the other thing you said, Naima, that I thought was really good, and I was thinking about, you know, do you feel like the stigma has been reduced in communities? But then you said the word normalized. And it made me wonder if, you know, do you feel like more people are embracing those who may be in services or recovery? Or I guess, what's your take on how are we trending in the last 20 years? You know, I can remember when you know, this is your brain on drugs, eggs commercial in a frying pan, right? I think we all at least are of that age where we know that commercial, which we won't get into age, but. And then I think about, you know, campuses across the nation that have that made up auto accidents, you know, to try to make an impact and that kind of stuff. Do you feel society wise, you know, where are we right now? Are we doing a little bit better than what we used to do? Or are people feeling like they can talk about it more? I mean, I feel like the pandemic has taken behavioral health to another level where people are talking about it. I think it's a little more acceptable. So how do you think alcohol is fitting in that mix?
So I think it's definitely become something where people understand, because it's hard now to find a person who doesn't know someone who struggles with addiction. But what people still have an issue with is that there's problem drinking and there's also meeting the criteria for addiction. There's two different, because a lot of people have problem drinking, and some of us really, and this is what I mean by attitude. We think if we're able to go to work, our kids are fed, if we don't have any legal issues, that we don't have problem drinking. But it's still a problem. And so, and then some people have this, well, I can control it versus this person can't. We still very much, and it's very interesting, find that judgment on I can do a lot of this and you can't must be some type of moral failing. So that's still very much around. I think it has gotten better because we just simply know people, we have relatives. But I find that even people within families, they don't get it. They don't understand. Why can't this person just stop? Everything is being taken away from them and they can't just stop. So there's still this confusion about what addiction actually is. But what I have people try to do is Have you ever tried to stop something that was an unhealthy pattern? Did you do it overnight? Probably not, because human beings don't tend to, even when it's destructive. And they're like, well, it's cost this person everything. Do you know human beings that when something was painful, that they automatically said, nope, not going to do that anymore? No. And no. And so human behavior is something, it's a learning process. Addiction, the reason people have an issue with it is they still think to some degree a person has a choice, and that is all choice. And I can just tell you from our personal experience, for a lot of people, there are some choices that are involved, but we still have this very much this attitude of that person can make this better if they just try hard enough.
Yeah,
Overnight.
thank you.
Overnight.
great.
Sorry.
No, very well said. I appreciate that. Thank you. For listeners just joining us, this is the UP Community Health Town Hall series, and tonight's discussion is about alcohol awareness. Those listening on the radio, please feel free to email any questions in at ruralhealth@nmu.edu. Those joining us on Zoom, please feel free to use the Q&A if you'd like to send in any questions at this time. I'd like to introduce our next panelist, Amy Poyer. I've seen you 3 different times today, so thank you for hanging in there with us, and joining tonight. Amy works at Great Lakes Recovery Center as well. She is going to talk a little bit about the different residential treatment facilities, identifying where they're located right now throughout the Upper Peninsula, and she'll share a little bit of Great Lakes Recovery Center statistics as well. Thanks for joining us, Amy.
Yeah, thank you for having me. I guess I want to start out by telling you some of our statistics. So many have shared statistics tonight. I will just join in that. So in fiscal year 2022, which was last year, the drug of choice for our outpatient program was alcohol, and it was alcohol by quite a bit. It was the drug of choice for 46% of our outpatient clients all across the UP. And the next highest was opioids, and that was at 27%. So you can see quite a big difference there. It is also the drug of choice for several of our residential treatment facilities. Our treatment facility in Marquette, alcohol was a drug of choice for 48% of the clients, and methamphetamines were the second drug of choice at 35%. In Sault Ste. Marie, at our men's facility, alcohol was a drug of choice for 50% of clients, with the second being 28%, and that was methamphetamines again. Our women's facility in the Soo kind of takes a different stance on this. Their stats are always a little bit different, but for the women's facility in the Soo, alcohol was the second drug of choice, and only 24% of the women had alcohol as their drug of choice, whereas 50% of the women said methamphetamines were their drug of choice. Again, at our adolescent facility, the stats are a little different than with our other sites. Cannabis was the drug of choice for 61% of the kids at our adolescent treatment facility, and alcohol was the second highest. That was only at 17%, however. So again, a big difference there. And with legalization, that has probably upped those numbers. GLRC does offer services all across the Upper Peninsula, and Naima shared the different levels of services. If you want to learn more about any of our services, you can find that information on our website, which is greatlakesrecovery.org. And you can look into outpatient counseling, residential treatment, recovery housing, or any of the other programs we offer. We offer actually quite a bit that is not substance use related as well, and you can find that information there. But if you're ready to take that next step and you would like to get services for yourself, or if you would like to learn about them for somebody else, you can call our Access Center. And our Access Center is located in our newest facility that's in Negaunee. And the number there is 906-228-9696. We do have trained staff there during business hours, and they can help you work through the best level of care for you. They can walk you through the process. They'll also help you look at the funding aspect of it. There is a fee for our services. Insurance does help cover that fee depending on what your insurance is. If you don't have insurance, we can look at some other types of funding. And again, the Access Center will help you with that. They can walk you all through the funding process as well. And they actually can verify your insurance right there while they're talking to you. So as I noted, and as Naima said, we do have services all across the UP. I won't go into the outpatient offices because we do have quite a few of those across the UP, but you can find those locations on our website. And if you are not located near one of those outpatient services locations, we do offer telehealth. And again, the Access Center can help you with that. As far as our residential facilities, we have 3 residential facilities for adults. Right now, we have one in Marquette, and that houses both men and women. That's the one that Naima works at. And then we have 2 residential treatment facilities in Sault Ste. Marie, one for men and one for women. We also have the only residential treatment facility for adolescents. We serve kids between the ages of 12 and 17, and it's the only one north of Clare, Michigan. And that is located in Negaunee, right next to our new facility. Naima also talked about recovery housing. We do have several recovery houses across the UP. We've got 2 in Marquette, one for men and one for women. We also have women's facilities in Lance and Sault Ste. Marie, and we have a men's recovery house in Sault Ste. Marie as well. Currently our 2 women's facilities in Lance and Sault Ste. Marie will allow children to come with them into the recovery housing. And soon we will be moving our recovery house for women in Marquette, and women will be able to take their children to that as well.
Amy, can you talk a little bit about the event that took place today and what's going to be happening at the Negaunee location?
Sure. So we had a press conference at our newest facility in Negaunee today. It was quite exciting. We last year transitioned the ownership of the Teal Lake Medical Facility in Negaunee over to Great Lakes Recovery Centers, which will allow us to have a full behavioral health campus. In that campus, we currently offer integrated care. So we offer medical services as well as outpatient services for substance use and mental health. We have youth psychiatric services available there. We have an opioid health home program that we operate out of there and medication assisted treatment. And as I said, our Access Center is in that location as well. Right now, today we just announced some exciting funding that we received that will allow us to continue the renovations that we're doing on the facility. And with the renovations, we are going to be bringing the women's portion of our adult residential treatment program to the new location in Negaunee. So women will now have their own facility for residential treatment on Marquette County. And we are also going to bring Sue B's house, which is our recovery house for women, to the Negaunee location. So both of those sites, residential treatment and recovery housing, will be in the same location in Negaunee, and women will be allowed to take their children to both of those facilities. And we have a daycare, we will have a daycare once we finish construction and renovation on site for women while their children are, for the children while the women are receiving care. So.
Great. Amy, can you talk a little bit about how Great Lakes Recovery Center partners with other organizations?
Sure, we love to partner with other organizations, and we do so quite a bit. We have been working with Marisa, Market Algerisa, quite a bit recently. They have a mental health task force that we have been greatly involved with and working on how to get the best services that we can for our kids and what the community needs We are looking at some small projects in that group as well as some quite large projects with that group. And we're hoping to be able to get funding to move forward with some of those projects soon. We work a lot with the courts. I am just working with the juvenile court on one project to get some, Tracy had talked about the QPR, question, persuade, refer training. The courts are going to be working with us to train some community providers in that course. I just talked with the Ishpeming Senior Center last night about doing some new partnerships. And of course, we partner with NMU Center of Rural Health whenever we can as well. And we're always looking for new opportunities. So if you have something that you think we would be a good partner with, please reach out to us. I love to talk about new partnerships anytime I can.
Thanks, Amy. We've got just a couple minutes left, but I was wondering if you could talk about, I know you and I have had this discussion before, but what's at least one thing you think that could be done that could assist with reducing alcohol use or the glorification of alcohol, in our region?
Right. Yeah, you and I have had that conversation. I think stigma is such a big thing. I think we need to cut down on the stigma surrounding mental health, including substance use disorder. And just as Naima was talking about, the normalization of alcohol use and young kids using alcohol at the 6th grade level. So many of them are already knowing what alcohol use is about. If we could just open the conversation, talk about what that does to the young brain, and talk about how we can do events in our society and in our culture without bringing alcohol into the events. There's a lot that you can do. There's a lot of fun things you can do without the use of alcohol and other drugs.
Absolutely. No, I think that's a very good point. And I know that, there's a lot of people that have expressed that, but I don't think we can say that enough. There are plenty of ways to be able to celebrate together. So.
And I think too, as we've learned more and more evidence is coming out that the idea that 1 or 2 drinks a day is okay, and we're finding more and more evidence that it's not. That Canada has actually changed their guidance that low levels of drinking are 2 drinks a week total, instead of this idea of 2 drinks a day, but 2 drinks a week. And that because there are negative health effects of drinking even 3 to 6 drinks a week in terms of increased risk, especially for breast and colon cancer, as well as things like blood pressure. But the good news is if you stop, then it does go down. So that's always a benefit as well.
Great. I want to take a moment to thank all of our guests for joining tonight. Gino Bazzanesi, Trooper Jake Mundy, both in the Iron Mountain Post. Thank for taking time to be on the panel tonight. Tracy Johnson with Dickinson Iron Communities That Care. Naima Jones, Amy Poyer from Great Lakes Recovery Center. It's been a real pleasure having everybody on tonight. I think this was a really important topic, something that I hope will continue to be discussed, throughout our communities. And just look forward to continuing to collaborate with people to get the word out. So, this is great. And I appreciate the time that you took. And I'd like to thank our audience as well for listening and joining us tonight. So